where evidence meets encouragement, and information becomes transformation. I'm Dr. Ferris Corbett, alongside my colleague, Dr. Deidra Willis, and we want to thank you for joining us today. We don't take it lightly that you've chosen to spend this time with us. Here at Health Talk, our goal is simple: to provide you with clear, trustworthy, and practical health information, so that you can make informed decisions about your life, your wellness, and the well-being of those you love. From public health to mental health, from prevention to healing, we believe knowledge is power, but wisdom is action. And together, we'll explore both. So, settle in, open your mind and heart, and let's take this journey toward health, hope, and wholeness together.
Good evening, and I hope everyone is having a good night, good evening, and that your day has been one that has been full of life, energy, and that you had a very good day. Thank you so very kindly for joining us here tonight, here on Talk. All right, so good evening, family and friends and loved ones and everybody. Thank you for taking a moment to join us here tonight on Health Talk. We have a topic tonight that I think deserves our attention. Okay, welcome back to Health Talk. I am your host, Dr. Ferris Corbett, and tonight we are tackling a topic that affects every single one of us. Not a one of us is exempt. Whether you are insured or uninsured, whether you live in rural community or urban community, and whether or not you are a patient or a professional. Hospitals are closing, clinics cutting off staff, nurses are leaving the profession. Public health funding is drying up. And while families are struggling to afford medication and basic care, the system that was built to protect their health is quietly being dismantled. Now, this is not politics. This is people lives. So tonight, we're pulling back the curtain on what is really happening in American healthcare and what is that we can do about it. Hosea 4:6 says, "My people are destroyed because of the lack of knowledge." So tonight, our goal, our hope is to provide you with that knowledge on tonight, okay? So I am so glad that you took the time out of your busy schedule. And if you even catch this on replay, thank you so very kindly for taking a moment to join us here on Health Talk. This is a topic that deserves, as I said in the intro, that deserves our attention. We need to have this discussion. Okay, we need to have this discussion. Again, welcome to Health Talk. All right, let's provide you with some facts here. As we always start out with, did you know that as of 2025, this year, over 432 hospitals across the United States are considered vulnerable to closure. And in just the past year, 18 have either shut down or eliminated inpatient services. With financial reserves nearly gone and Medicaid cuts looming, over 300 more are now at risk of losing essential care. That is frightening, people. And um, in just the last few months, hospital was once counted on have either shut their doors or dramatically or drastically cut essential services. This is alarming. Think about that, okay? For instance, in Chicago, the Lewis A. West Memorial Sinai Bethel Israel, in April of this year, they closed their doors. They're no longer open. In New York City, the historic Mount Sinai Bethel Israel. I'm sorry. Let me rephrase that. In Chicago, the Lewis A. West Memorial Hospital shut down its ER and inpatient ward in August of this year. So in Chicago, the Lewis A. West Memorial Hospital shut down its ER and inpatient wards in August of 2025. And in New York City, the historic Mount Sinai Bethel Israel, they closed in April of 2025. Also, in Washington, D.C., United Medical Center closed its doors April the 15th, 2025. And in Florida, Shore Point Health in Punta Gorda closed last fall, leaving entire counties with no local hospital. And in rural Northern California, Glenn County just lost its only ER as Glenn Medical Center closes this fall. People, this is alarming. This is very alarming and very disturbing. We have hospitals that are closing. People are losing access to health care services that they need. This is a very alarming situation and a very concerning situation. And that is why we're here tonight to have that discussion about this situation and what is occurring across the United States within the healthcare system. And this is something we need to talk about. Okay? All right. Now here is what this public health crisis really looks like in the lives of everyday Americans. This is not hypothetical, but real patterns grounded in truth and lived experience. Let's think about these as we talk about them here. These are not hypothetical, they're not fictitious, they're not hyperbole, but these are real patterns that are grounded in truth and lived experience. And we need to talk about it. Okay? We need to have that discussion about it. So, in rural Georgia, a 68-year-old woman who has diabetes has to drive over 75 miles every month to get her insulin because her local hospital shut down. That's disturbing. I don't know about to you, but to me, that is disturbing. A 68-year-old woman having to drive 75 miles every month to get her insulin. And that's 75 miles one way. So round trip, she's doing 150 miles every month just to get her insulin because her local hospital is shut down. Now, this is not a story from a movie, people. It's the reality that hundreds of patients across rural Georgia, Alabama, Mississippi, who have lost, nearby care. So this is something we really have to think about and have that discussion about. Okay? Also, in Mississippi, where 38% of counties are now considered maternity care desert. Women are dying simply because there is no obstetrician or labor unit available. 38% of counties in Mississippi are now considered maternity deserts, and women are dying because there's no obstetrician or a labor unit that is available to provide them the care they need. Roughly 238 rural hospitals across the United States have closed their OB units. This is alarming. And I hope you're finding this to be alarming and disturbing to you. In South Carolina, veterans are struggling to access mental health care. People, this is so discouraging and downhearted. In the state of South Carolina, veterans are struggling to gain access to the mental health care that they need. Now, a Post and Courier investigation revealed that many veterans wait months for counseling, mental health counseling, or psychiatric follow-up. Very alarming, very concerning. Okay? Now, the state newspaper in South Carolina report that some veterans in rural areas have to travel more than 80 miles to see a provider because their local VA partnership clinics have closed down. So when I say a veteran cannot get mental health follow-up because his clinic shuts down, that is not a metaphor. That is a documented reality that is happening right now. This is disturbing. Again, to me, this is disturbing and alarming, and I do hope that you that are watching this podcast, whether live or catching it on replay, would find it alarming and disturbing for you as well. In Detroit, where the cost of living has soared, but wages have not, families are being forced to choose between rent and survival. Now, the Detroit Free Press recently profiled a gentleman named Marcus Henderson. He's a father of two. He skipped his blood pressure medication because he could not afford both his prescriptions and rent in the same month. And he's not alone. A national health interview survey conducted by the CDC in this year, 2025, found that 1 in 4 adults in this country skip medication due to cost. Think about that. How alarming and concerning is that situation? People are going without their medication because they're having to make a choice between rent, food, or their medication. Think about that. These are not dramatization. They're not fictitious. They're not made up. They're not um, hypotheticals or hyperbole. These are reflections of documented reality. This is happening. Behind every statistic is a name, a face, a story. And the heartbreaking truth that for millions of Americans, access to health care now depends more on their zip code than their need. This is troubling. This is very concerning. And that is why we here at He Cares Training and Education Center are bringing you this so that you can be made aware and be presented with facts and evidence-based scientific research concerning these matters. Think about that. Now, let us talk about something that is not getting enough attention. The crisis inside the workforce that once held our public health system together. Let's talk about that. Over the last 6 to 8 months, new policies, funding cuts, and restructuring efforts have shaken the very foundation of our healthcare and public health institutions. Veteran scientists, physicians, and health directors, many who have served faithfully through multiple administrations and crises, are leaving, not from pandemic exhaustion, but from disillusionment. Recent policy shifts, funding cuts, and system overhauls have shattered morale across the nation's healthcare and public health workforce. Veteran scientists, physicians, and public health leaders, many with decades of experience, are walking away. Not, as I said, because of a pandemic, but because of disillusionment with bureaucracy, politics, and eroding trust in leadership. This is very serious. When reform becomes replacement and public service becomes politicized, people leave, and with them, the experience and institutional memory that our system desperately needs. critical. This is not burnout. It is moral injury. It is what happens when those who devote their lives to service now feel powerless in a system that no longer protects, respects, or values them. Just in the recent months, senior epidemiologists have resigned from the CDC, citing their reason as interference and disillusionment. State health directors from Ohio, Missouri, and Georgia have stepped down midterm, publicly admitting they could no longer navigate the political pressure. And hospital CEOs and medical directors across the country are retiring early, not because they do not love the work, but because they cannot fight a system that is bleeding out from the inside. In fact, one public health leader said, and I quote, "We didn't leave because of the work. We left because we weren't allowed to do the work," end quote. That statement alone captures exactly where we are right now. In a moment when policy, not people, is driving the agenda. And when the people who holds the knowledge, compassion, and historical context of our health system are gone, the nation loses more than staff. It loses its stewardship of trust. So, the real question is not what is wrong with the healthcare system. It is what happens to a nation where its healers, scientists, and protectors stop believing that the system they serve believes in them. But here's the point I love sharing, because I believe in hope through awareness. And that is why we are doing this podcast tonight, is to raise your awareness. Change, it's still possible. Reform does not start in Washington. It starts in us. Okay? Community partnerships, faith-based organization, nonprofits, and wellness centers, such as He Cares, can fill education and prevention gaps. And that's what we're here tonight doing, providing you some education. Health literacy. The more people understand, the fewer end up in the ER. Okay? Local engagement. Attend health board meetings. Advocate for funding and support community clinics. This is things we can do. We don't have to wait on Washington. Policy advocacy. Pressure lawmakers to invest in prevention, not just treatment. Education. Encourage young people to join public health, nursing, and wellness careers, the next generation of protectors. Galatians 6:9 says, "Let us not be weary in well-doing, for in due season we shall reap if we faint not." So we don't have to wait on Washington. We can begin those changes now amongst ourselves. Okay? Now, as you know, we always would like for you to get involved. We would like to hear your thoughts on these matters. So we're going to put a few questions in the chat comment section so we can hear what you have to say. All right. So we want to hear your thoughts because your thoughts matters. Okay. Your thoughts matter because your health matters. Okay. And so we're going to get ready to present you with questions for the evening. And just go ahead, leave your response in the chat section, the comment area. And if you are uncomfortable with leaving your response in the comment chat area, we are going to make provision for you to send your response to us um, via another avenue, and we will put that on the screen in just a few moments, okay? So, our first question that we want to present to you is when you hear about hospital closing or staff shortages, what emotion does it stir in you? Leave your comment down in the chat section, okay? Leave your comment there. Let us hear what you have to say. All right? So, again, when you hear of hospital closing and staff shortage, what emotion does it stir in you? Leave your comments down in the chat area in the comment section. Let us hear your response. Let us hear what you have to say. And of course, if you're uncomfortable leaving your response in the chat area in a public setting such as this, we will provide you the opportunity to leave it in another setting. Okay? The next one is what is one way you can personally support health and wellness in your own community, even in a small way? Okay, that's the question. What's one way personally that you can support health and wellness in your own community, even in a small way? Leave us your thoughts down in the comment, in the chat section. Let us see what you have to say. We would love to hear your response. We would love to hear what you have to say regarding this matter. So go ahead and leave that comment down there. Okay? We'd love to hear it. We'd love to hear from you. All right? The next one is if you could reform one part of the system, what would you fix first? Access, affordability, or awareness? So if you could reform one part of the system, what would you fix first? Access, affordability, or awareness? Leave us your thought down there in the comment section. We'd love to hear from you on that. All right. And the last one is on a scale of 1 to 10, how confident do you feel about navigating your own health system? And what can make that number 1 point higher? So on a scale of 1 to 10, how confident do you feel about navigating your own health system? And what could make that number 1 point higher? Okay. All right. We're going to present these questions to you again. Leave us your thought in the comment chat area. And if you are uncomfortable with responding in an open forum such as this, we are going to provide you another avenue wherein you can provide us with your response. Okay. So, first question again is when you hear of hospital closing or staff shorting, what emotion does that stir in you when you hear this? Okay. Go ahead, leave us your thought down in the comment section. Let us hear what you have to say. And if you're uncomfortable, we will provide you here shortly an avenue wherein you can provide this response. Okay. The next one again is what's one way you can personally support health and wellness in your own community, even in a small way? Leave us your thought down in the chat area in the comment section. And again, if you're uncomfortable with leaving your response in an open setting such as this, we're going to provide you an avenue in just a minute. All right? And if you could reform one part of the system, what would you fix first? Access, affordability, or awareness? Leave us your comment down in the chat section. We'd love to hear your thoughts on that. Okay? And lastly, sorry. And lastly, on a scale of 1 to 10, how confident do you feel about navigating your own health system? And what would make that number 1 point higher? Again, leave us your thought down in the chat in the comment section. And if you are uncomfortable about leaving your response in such an open setting as this, then you can visit us on our website. It is on the screen. The hyperlink is in the chat comment section. Click on that hyperlink and it will take you to our website. Leave us your thoughts, your comments there, or you can send us an email. The address is on your screen and down in the chat. Okay, so you can provide a response to those questions. And not only can you provide a response, but if you have a particular topic that you would like for us to discuss on here, shoot us that message. Go to our website. The hyperlink is in the chat comment section. Click on there. We have a space on the website that you can provide your comment, and you can provide a request for a particular topic that you would like to hear. All that information is accessible on our website, or you can simply send us a email. All that information is in the comment chat section. The hyperlink to the website is in the chat section. Click on that and it will take you directly to the website. Okay? Remember, awareness without action is only half the battle. Okay? Now, at He Cares Training and Education Center, LLC, we are not just talking about public health, we're living it. I am a public health practitioner, and Dr. Willis, she is a practicing nurse practitioner. Okay? We bridge the gap between education and access, bridging and bringing to you evidence-based workshops, CEU's training, and community wellness program that empowers everyday people to take control of their health before crisis hits. Okay? Reach out to us. Let us know how we can be of service to you. We do, as we said, we do workshops, we do CEU trainings, we do wellness programs, coaching programs, whatever service. You just reach out to us, let us know. And again, you can reach out to us, go to our website, or you can send us an email. We would love to hear for you. At He Cares Training Education Center, LLC, we also provide trauma-informed care. We provide nutrition education. We provide faith and mental health and holistic coaching. Our mission is simple: 3 services, 1 purpose, and that's you. Okay, you have our information. And we would also like to announce that on November the 1st, y'all excuse my nose is just going crazy here. On November the 1st, we will be having a faith wellness, trauma-informed wellness community session on November the 1st. I'm going to try to put that information on the screen. Let me see if I can get it on the screen here. All right, it's there on the screen. So He Cares Training Education Center, LLC, in collaboration with Christ the King Ministry, will be presenting a faith and mental health, a trauma-informed wellness session on November the 1st, 2025, 11 a.m. to 1 p.m. at 308 Carter Street in Timminsville, South Carolina. You can scan that QR code there on your screen. It will take you to Eventbrite to go ahead and register to attend this event. We would love to see you there. So go ahead, scan that QR code, and we would love to see you attend this event with us. It is a community event. Okay. All right, family. I want to leave you with this thought on tonight. A strong nation does not begin in Washington. It begins in the wellness of its people. Every clinic that stays open, every health worker who stays inspired, every neighbor who learns something new, that is a victory. And tonight, we hope that you have learned something new. Okay? Yes, public health is under fire, but it is not defeated. Okay? Because the power to change this story does not lie in the hands of bureaucracy, it is in our hand. Okay? Thank you. Thank you so much for joining us here tonight on Health Talk. Do us a favor, if you will, please. Take a moment, tag somebody, tag them in this here podcast. Okay? Share it. Share it. The more you share, the more this information gets out to the public, and the more we can gain greater victory. Remember what I said? It doesn't begin in Washington. A strong nation doesn't begin in Washington. It begins in the wellness of the people, you and I. So share this podcast with someone. Okay? Tag someone in it. Make sure you give us a thumbs up. Okay? Also, if you're not following us on our Facebook Health Talk page, please head over there and follow us on Facebook. And if you're not subscribed to our YouTube channel, please head over there, hit that bell. First, hit the subscribe button. Hit subscribe. Then hit that bell so you can get notification each time we present new content or when we come live. And don't forget, give us a thumbs up. Make sure you like, tag, share. All those good things, they help to get this message out to a broader community. It helps spread the message, and it helps to educate and inform more people. And you are a critical part of that information being disseminated to many other individuals across this United States of America. Okay? Knowledge is power. And when you are provided knowledge, it helps to make a definitive, informed decision based on facts and not hypotheticals, not hyperbole, but based on facts. I am your host, Dr. Corbett. My colleague, Dr. Willis, is not with us tonight, but we want to say thank you for being a part of our community, for taking time and listening to our podcast, sharing our podcast, sharing your thoughts and your ideas, for just being you. We are so greatly appreciative of you. Don't forget, make sure you follow us on our Health Talk Facebook page. Make sure you go over to our Health Talk YouTube channel. Make sure you subscribe there and hit that bell so you can get notification. And don't forget to leave us a like and a thumbs up, okay? Thank you so much again for joining us here. Whether you caught us on the live or whether you catch us on the replay, thank you. Don't forget, knowledge is power. Your health is important. And we at He Cares Training and Education Center, we say, because your health matters. Until the next episode, God bless you, stay healthy, and